For centuries, humankind has relied on natural medicines and physical methods to control surgical pain. You had your natural sedatives such as cannabis, mandrake, henbane, and opium poppy, or you could use more physical methods such as cold, nerve compression, or even concussion. Needless to say, these had variable effect. The modern era of anesthesia began in 1846 when William T.G. Morton, a New England dentist, became the first to publicly demonstrate the use of diethyl ether as a general anesthetic at Massachusetts General Hospital. And then later that year, John Collins Warren removed a tumor from the neck of a local printer. Upon completion of the procedure, he quipped, "Gentlemen, this is no humbug." So follow me as we step back in time to the bustling, ultra-modern streets of early 20th century New England, where we'll encounter the IV anesthetics. Modern anesthesiology relies on the use of combinations of intravenous and inhaled drugs in an effort to balance the favorable properties of each agent while minimizing adverse effects. In this sketch, we're going to focus on anesthetics that are administered intravenously, and that's why throughout the dank and narrow streets we've incorporated our recurring symbol for IV administration, that climbing IV, IV. IV anesthetics are used to facilitate rapid induction of anesthesia and have replaced inhalation as the preferred method of anesthesia induction in most settings. These agents are also commonly used to provide more minor sedation during monitored anesthesia and for patients in the ICU. As we introduce the IV anesthetics one by one, we're going to highlight their use during the induction phase versus the maintenance phase of general anesthesia. Additionally, we'll briefly mention mechanism of action as well as any unique adverse effects. Let's get to it, shall we? Step right up! Don't be shy! See if you can resist as his trance-inducing magic penetrates your CNS! Introducing Prospero the Hypnotist! Prospero will embody the IV anesthetic propofol, the most frequently administered drug for induction of anesthesia. Induction specifically will be highlighted by the word introducing, and you'll see this word pop up throughout the sketch. The IV anesthetics used for induction of general anesthesia are lipophilic and preferentially enter the brain and spinal cord, which accounts for their rapid onset of action. Just think of propofol as that milky white bolus injection that the anesthesiologist will push in order to make the patient fall asleep. The pharmacokinetic profile of propofol specifically allows for continuous infusion. Thus, propofol is also used during maintenance of anesthesia, and that's why we've included this sign here challenging passersby to maintain their sanity as Prospero works his sedating magic. Propofol can be used for the maintenance of anesthesia either by itself or as part of a balanced anesthesia regimen in combination with inhaled anesthetics, sedative hypnotics, and opioids. The presumed mechanism of action of propofol is through potentiation of the chloride current mediated through the GABA-A receptor complex. Yeah, it's that same GABA-A complex that facilitated the action of all those sedative hypnotics from the previous chapter, including benzos, barbiturates, and those non-benzodiazepine hypnotics. So take a look behind Prospero and you'll see our recurring symbol for the GABA-A receptor. It's the GABA-A cab, of course! Though this time it's more of an early 1900s buggy, because at Sketchy we strive for the utmost historical accuracy based on the history we learned from reading the Sherlock Holmes books. Okay, fine, watching the movies, but that Dr. Watson. Compared with other induction agents, propofol produces the most pronounced decrease in systemic blood pressure. This is due to profound vasodilation in both arterial and venous circulation, leading to reductions in both preload and afterload. So take a look at Prospero's outfit, and you'll see that we've included our recurring symbol for decreased vascular resistance, those baggy, dilated arterial sleeves and venous pants. And now it's time to introduce our next IV anesthetic. It's the beast from the east, the E-Tom Bomb. Introducing the Intimidator! Let him represent the IV anesthetic etomidate, an alternative to propofol for the rapid induction of anesthesia. Again, induction is highlighted by the word introducing. Etomidate appears to act primarily through the potentiation of GABA A-mediated chloride currents like most of the other IV anesthetics. So remember that GABA cab in the back. One distinct feature of etomidate is in its ability to preserve cardiovascular stability after bolus injection. So, as he stabilizes that anesthetized volunteer above his head, remember that etomidate causes minimal changes to blood pressure, heart rate, or cardiac output. Useful for induction of anesthesia in patients with compromised myocardial contractility. Next, I'd like to introduce that mysterious wanderer from some far-off land. It's the snake-taming nomad! He'll embody the IV anesthetic ketamine, and notice that we've even incorporated the word ketamine into the sign above him. Snake-taming nomad. Not only that, let the word nomad remind you of the NMDA receptor. The mechanism of action of ketamine is complex, but the major effect is probably produced through the inhibition of the NMDA receptor complex. Inhibition specifically is illustrated by this nomad's camel hitched, or inhibited, if you will, to the post next to him. The characteristic state observed after induction dose of ketamine is known as dissociative anesthesia, during which a patient's eyes will remain open with a slow, nystagmic gaze, much like the dissociative trance induced by the gaze of the ketamine king cobra. Hey, get a hold of yourself. What did I tell you about looking directly into its eyes, huh? Just calm down, it's gonna be okay. You're probably just feeling some of the unpleasant reactions that occur when emerging from a ketamine-induced dissociative state. These emergence reactions include vivid, colorful dreams, hallucinations, and out-of-body experiences. What's that? Oh, you're experiencing some kind of distorted visual, tactile, and auditory sensitivity? Yeah, that's normal. Reactions are also associated with fear and confusion, but a euphoric state may also be induced, hence ketamine's illegal use as a recreational drug, Special K. Instead of cardiovascular depression, ketamine can produce significant increases in blood pressure, heart rate, and cardiac output. Just think of the unmistakable heart shape formed by this ketamine king cobra's hood. Ketamine's other unique properties, which include analgesia, bronchodilation, minimal respiratory depression, and convenient routes of administration, make it an important alternative to the other IV anesthetics and a useful anesthetic for mentally challenged and uncooperative pediatric patients. Benzodiazepines such as midazolam and lorazepam are also used in the perioperative period. Wait a minute, is that? It is! It's the same Ben's Diner from our benzodiazepine sketch. Wow! So it's been here since the early 1900s, huh? I'm sure they're still serving that same old water. Rife with cholera for that authentic turn-of-the-century taste. If you look closely at the water pump outside, you'll notice the uncomfortable resemblance to a scope heading down a bowel. That's because many diagnostic and minor procedures such as colonoscopy can be performed without general anesthesia using sedation-based anesthetic techniques. IV benzodiazepines, for example, can be used to induce a state of conscious sedation when the patient's able to maintain a patent airway and even follow commands during the procedure. Check out our Ben's Diner sketch for an in-depth discussion of the sedating and anticonvulsant properties of the benzodiazepines. Upstairs, I'd like to introduce you to our last agent used for the induction of general anesthesia, the barbiturates. I want to say last but not least, but really they are least because barbiturates have been largely replaced as induction agents by propofol. Nevertheless, Sweeney Pentel, the demon barber, is open for business, embodying the barbiturate thiopental. Back at our barbiturate barbershop sketch, we called thiopental Thiol Quick Shave, and that's because it's an ultra-short-acting barbiturate used for induction during rapid sequence intubation. Thiopental is highly lipid-soluble and immediately enters the CNS to take effect. Just think of Sweeney Pentel here about to courteously and safely shave his next victim, patron. Not only is it quick to act, however, its duration of action is pretty quick too, only about 5 to 10 minutes. Much like the time it takes Sweeney Pentel to finish you off. Finish your haircut. Be sure to check out our barb shop sketch for more info. Alright, that's the last of the IV anesthetics. When I clap 3 times, you'll be released from your trance. and we'll move on to our next sketch covering the inhaled anesthetic agents.